I know that you often work with people who have already seen maybe a number of different physical therapists. And so then they come to you, they're referred to you for exercise intolerance after a concussion. And so now you have to kind of troubleshoot with these more complex cases. Like, okay, they've kind of done, some of the kind of standard protocols that might be done in physical therapy. So how are you approaching like those more complex cases differently when you've got somebody who doesn't necessarily they're not able to tone their nervous system so quickly, or with these kind of standard return to exercise protocols?
Yeah, I mean, my biggest pet peeve, and I understand why we have protocols. It's not that all protocols are bad. It's that, hey, we did the treadmill test and we found, they're symptomatic at this rate. And then they have a protocol that says, oh, you should be able to do 20 to 30 minutes at X heart rate. The person's like, no, I get symptomatic doing this. And a lot of times it's unfortunately the healthcare provider enforcing a protocol that clearly is not working. Right. And not necessarily their fault per se, but then because of the negative associations, you're actually, tending to make people worse. You tend to drive up their sympathetic tone. Sometimes by the time I get people, there's been more than one case where I've been like, okay, Bob, your job today is you have a rower at home. Great. I want you to sit on the rower. Don't even put your feet in the straps. I don't even want you to row today. I just want you to sit there and do a long exhale and monitor your heart rate and do that for 2 minutes and then let me know. And they're like, what the hell are you talking about? This is the stupidest thing I've ever done in my life. How is this going to help me with exercise? I'm like, because everything we've tested so far makes you symptomatic. Like 30 seconds made this person incredibly symptomatic. So let's just get your nervous system acquainted with the machine, the environment, the thoughts of potentially doing exercise. Let's make sure that's stable first, and then we'll actually have you start to exercise. And they think I'm just a complete Looney Tune. But you have to go sub-threshold. You have to get under the threshold they're doing. If they're becoming intolerant and massively symptomatic within 10, 20, 30 seconds, there's not really any lower you can go, right? Or I might change modality, or I'll tell them, whatever device you were using before, if at all possible, like don't use that again. I don't want any neurologic associations with that piece of equipment. I get it. If it's the only one you have, there's not much you can do. But if that was at your gym and you have access to one at home, use the one at home. Change the music, change the environment, anything to make it to literally tell your nervous system this is something different, so we can kind of like erase the little Etch-a-Sketch thing and just kind of start over again.
So
And most people won't go far enough down to start. Like I've had people referred to like, I don't know what to do, man. They can't even do 20 minutes of exercise. I'm like, 20 minutes, man, that might be a shit ton for the person. Have you thought about maybe trying 18 or 10 or 5? Like, oh, but they're not going to get any effect then. I'm like, well, true, I get it. Like you can't have someone only exercise for 30 seconds a day the rest of their life and expect miraculous things to happen. But if they're becoming symptomatic and they're having issues, like you have to go and regress the thing to some degree somewhere. So that's just like my biggest pet peeve.
Yeah, so you're really paying attention to this mind-body connection between seeing that people have been trying to exercise, and now they have these negative associations with, say, a treadmill, where now it's like they go to a treadmill and it's almost like their exercise intolerance is getting worse due to this kind of psychological stressor and association of the treadmill essentially with failing, or with feeling like they're not getting better. And so you're kind of approaching this and saying, okay, we're going to do something other than a treadmill, and we might just need to like sit on the rowing machine and just be comfortable with sitting there and not doing anything first before even attempting to start an exercise program.
Yeah, and if they're a former athlete, a lot of times it's even harder because they keep comparing themselves to what they could do even like 2 weeks ago. They're like, I don't get this. Like 2 weeks ago, I could do a 5K on the freaking rower and it was sub 20 and it was amazing. I'm like, I get it. Like it's frustrating, but wherever you're at now is where you're at. So I literally tell them, like, get a new training notebook. Like everything at this point is like a new PR. Like just don't compare yourself to where you were before. I'm not saying you can't get back there at all. I'm just saying that if if you're always trying to compare yourself to where you were before, you're going to constantly just keep torturing yourself every day, and you're going to go
Mhm.
backwards, and you're going to be more frustrated, and it's going to be harder. It's like digging a hole. Like the first step of, hey, I'm stuck in this hole. It's like, well, just stop digging, right? Just trust me, just do this first. I know it's frustrating. I know it sucks, but you've kind of clearly shown that the other approach isn't working because all your symptomology and everything is getting worse. So, and I get it. It's a hard thing to realize, and it doesn't make sense because they understand that they haven't lost capacity. They know they're not that detrained, but it feels like they're incredibly detrained and they can't do the output. So I get that it's incredibly frustrating for them.
Yeah. And so at the beginning you said, it's their nervous system that's putting the brake on the exercise, not their metabolic capacity. And so are you also incorporating different like head, eye, vestibular exercises in as part of their rehab program and kind of creating as a way to maybe create some more stability within their nervous system?
Yeah, so sometimes I'll get them with just a diagnosis. Sometimes, hopefully, most of the time, they're working with a clinical neurologist, functional neurologist, who will normally have them do certain rehab drills. And so the first question I'll ask the neurologist is, hey, would it be better for this person to do exercise potentially before or after their drills? Some people clinically will get better, but the drills are very fatiguing also and take a lot of effort to do. Some people, they provide a lot more stability. So I'm trying to figure out, okay, timing wise, would I have them do exercise in the morning and maybe do their drills 2 or 3 times during the day? Or a lot of people, the drills provide them that window of stability. So if that's true, I'm going to have them do exercise immediately after that. And I
Mm-hmm.
may even ask them, like, hey, if you could give this patient only one drill that makes them the most stable, like what drill is that? It might be this saccade or anti-saccade or, this head tilt or turn or whatever. So I'm probably going to have them do that a lot of times sitting on the rowers, sitting on the bike, sitting on the machine to try to stabilize their nervous system a little bit. Okay, now let's do some exercise. Sometimes, if they're very intolerant and those certain drills are very helpful, they may take a break and, okay, like next week, we're going to have you go 2 rounds now. You can exercise just 1 minute on the rower. You're not going to go above 100 beats per minute. You're going to get off, walk around. You're going to do, some type of, head turn drill or whatever. And now you're going to go again and let's see if we can do another minute. Right. So anything I can get to bridge any level of stability and then just kind of build on that.
Got it. And then do you find a benefit to emphasizing isometric contractions versus other types of therapy? So in some cases, I'll have people, practice more isometric holds or simple things like a wall sit instead of trying to, go for a walk or go on a treadmill.
Yeah, 100%. Like if they're really bad and really intolerant, the next question I'm asking myself is it escalating heart rate? Is it some sort of, neurovascular coupling? Is it moving blood flow around the body? Or is it just simply their physiology freaking hates that position, right? And so I'll literally, if I can, test them here, as simple as it is, hey Bob, let's get on the treadmill. Okay, let's put your hands up on the rower. Cool. And I'll just muscle test them. If everything goes to complete crap, ooh, okay. So now we know we've got an issue that this position, for whatever reason, your nervous system absolutely hates. We haven't even done exercise yet, right? So my next thought is, okay, how can I get them? How can I get their nervous system okay with that position? So I do some RPR, reflexive performance reset. It might be isometrics. It might be just proprioceptive drills, cerebellum drills, anything I can get so that when I retest them, their brain goes, "Oh, okay, this is an okay position now. We're okay." So that would be like step one in a perfect world. Um, a lot of times to get that, I find isometrics are super beneficial. You can set up in almost any type of isometric. I have a new device here. It's a Voltra One from Beyond Power. It's basically a box with a drive in it, and it has a little cable on it, and you can set it up to 200 pounds of resistance, and you can set concentric and eccentric changes. So I could say, okay, let's have you sit down on the floor and let's just have you practice just the rowing motion, but I'm going to give you some resistance now for it using the machine. So they would sit down, they would be in that position, and if that goes well, okay, cool. I'm actually then going to play with a faster concentric and higher eccentric load. So maybe make the pulling towards them really easy, and then I'm going to add 10 pounds of load pulling it back to the machine. It just seems like the eccentric component, when you overload it, I don't know if there's more proprioception or what changes, but after they're able to do a isometric, I find that that's like super beneficial. And usually if you just watch their form, like their form will clean up quite a bit. Normally you retest them, normally it's a little bit better. The cool part about the device is that I have an output on peak watts. So I can see how fast they pulled and I can see the load that they resisted against. So you can get fancy and use, some type of equipment like that. You don't necessarily need it. You could do any other types of exercise and things like that. So I'm trying to find a similar position and do some movement in that position. And then hopefully that position will be better. Okay, now Bob can get on the rower. Great. His nervous system doesn't hate me just sitting on the rower. Cool. He can do movement. He can pull the rower towards him. Nervous system likes that. Okay, now we can start to play with a little bit more of an elevated heart rate on top of that.
Mm-hmm. And do you ever play around with using weights, like either ankle weights, arm weights, weighted vests? I know sometimes, like, weighting somebody down actually has a therapeutic effect on their nervous system, just like a weighted blanket. And so by changing people's relationship to gravity and kind of how their limbs feel can also make a big change in their physiology. So do you play around with that as well?
Yep. So you can do like weighted vests, weighted implements. I stole this from Dr. Jeremy Schmo too, but I can't remember who came up with the device system where you have a little laser and you have to hit certain targets and stuff. I'll think of this system. But basically just take a cheapo laser. You can even add weight to their hand and then just have a figure eight on the sidewall. Okay, I want you to trace your hand with this figure eight. But when you're doing that, you have a laser that's following the figure eight. So they have external cueing to determine where they were. Okay, so now I want you to stay within this lane. Just move your arm up and down. You'll see it, kind of all over the place. But it's crazy how fast they learn because they have visual feedback as to where their limb is. So now they're coordinating the visual feedback to the proprioceptive. I find that was actually much faster than just having them only do it proprioceptively. So if there's anything I can incorporate like that, that tends to be helpful, especially with head movements and stuff. I have an iron neck device that looks like this weird halo you put on, and it just provides just enough resistance. So now they have a little bit of resistance to play against, and that sometimes will clean up different movements. You can stick a little laser on the top of there, and you can like, okay, rotate your head to the right. It's like, oh wow, that wasn't really rotating, was it? Like, because they can see there's something about them seeing their own movement and getting feedback that they can autocorrect a lot faster. Or I'll just do a lot of video. Okay, I'm gonna video you doing this. Okay, cool. All right, how clean do you think your head rotations were? I think they were pretty good. Okay, like, all right, do you want to see the video? Sure. Their head's like, doing this number. Like, oh shit, that was bad. I didn't realize I was doing that. Right. So anything just to get them to be more aware themselves, just to kind of clean up some of those patterns. Other thing you can do too is I have a K-box also, so flywheel. So anything with that eccentric load doing a squatting pattern, or the Vultra one, same thing, a little higher eccentric, have them hold on to something. Again, you're playing with hypergravity, right? So as they come up, they have to go faster up. And then when they come up, it's going to try to crush them back down. So again, just having that more kind of hypergravity effect. And again, it doesn't have to be a huge load at all. Like these loads generally tend to be pretty light. Just that difference appears to be pretty beneficial for a lot of people.
Yeah. So there's a lot of kind of remapping of the body and how the body moves through space, and having different aspects of resistance in different planes can make a big difference in terms of how the nervous system is then responding to movement.
Yep. And the big thing with that is I'll test them after like everything, right? So I just do simple kind of old school AK muscle test, but you could test range of motion. You could test eye movements. And then I actually teach them just how to do their own biofeedback. So I'll have them measure their own range of motion, just a flex forward bend. Stop wherever you feel the first resistance. Cool. Okay. Because a lot of people I work with online. Okay. So when you go home, okay, now you know how to test your own exercises. We played with a bunch of stuff. Your stuff that's probably going to work. But because your nervous system is not stable, I can absolutely guarantee that this drill we just did is not going to stay for 3 weeks. I can tell you it's not going to. So each time you do it, just do a range of motion test. Is it better or worse? If it's worse, great. Here's your top 2 modifications to change it. If all of those are still bad, just skip it that day. And if we see a pattern of, this exercise isn't really testing well ever again, we're going to drop it and go in a different direction. So I take a lot of time teaching them how to test their own range of motion so that they can then start to problem solve on their own too.
Yeah, I think that's great when people know that they can check in with themselves to say, did I do something my body didn't like? Did I push myself too hard, or am I okay? And can I actually maybe push that boundary a little bit more?